Children's Hospital New Orleans says it's dealing with a triple whammy of sorts.
Yeah, Sabrina Wilson has more on what parents need to know.
Kids with viruses are keeping medical staff busy at Children's Hospital New Orleans.
We are. We're as full as we've ever been right now, and most of it is respiratory disease. And a lot of it is enterovirus. We don't know whether it is specifically this enterovirus D68 that CDC has put out the notice on, but our test positivity rate for enterovirus and rhinovirus right now is above 40%, which is an extraordinary figure.
On Friday, the CDC issued an alert about enterovirus D68.
There's so much enterovirus right now. If we see children who have muscle weakness or the acute onset of paralysis, we need to be thinking about enterovirus D68 as a possible cause.
Children's Hospital Physician-in-Chief and Chief Medical Officer Dr. Mark Kline says there was an epidemic in 2014, 2016, and 2018.
It causes a respiratory illness, very much like RSV or influenza or COVID. And it can be quite severe. It can be severe enough to land a child in the intensive care unit, and children can rarely die from it.
That's scary. No, well, don't like to hear that.
Yes, of course I'm concerned. Everyone's concerned.
And then there's the flu. Kline, an infectious disease specialist, says some viruses are changing their patterns.
We're also seeing influenza A. It's unusual to see influenza this early in the season, but here we are in mid-September and we already have a lot of influenza circulating. And we're seeing respiratory syncytial virus. That's a virus that generally circulates in the winter, but here we are in September and we're seeing a fair amount of that. So it's kind of the triple whammy, to be honest with you, right now.
And Dr. Kline believes masks still have a place, especially when you're indoors around a lot of other people.
So hand washing is really key. I'm a big proponent of masks. We saw the benefit of masks when we were trying to prevent COVID. It prevented COVID. Masks do work for COVID, but it prevented these other viruses too that are spread by respiratory droplet.
Kline says there's much to be learned about how much COVID has influenced the circulation of other viruses. Again, they're seeing lots of patients with the enterovirus as well as RSV and the flu. Lauren?